You're listening to Allman in the Morning, Common Sense Radio.
Good morning, you bunch of drunks.
I am Superman, and I know what's happening.
I'm going to play that bit from Chicago again for you at 8:20 in case you missed it after Todd's on with us, and it is really has an effect. And KT, you watched it too, and he's 18 years old, so he's a sage. He's a voice from the urban areas, and I don't think enough people hear. So we'll follow up on that. Meanwhile, speaking of Supermen, how about Dr. Scott Haldeman from SoundHealthServices.com? How you doing, buddy?
I'm good, thanks. Thanks for having me on, Jamie.
Well, I'm really proud to have you on board as another supporter of free conservative radio here at Allman in the Morning, so I appreciate that. But I went out to visit you guys. And Dave Hinkle, how you doing, brother?
I'm doing fine.
Good to see you, friend. I went out to see your operation, and it is amazing. I mean, this is a network, so to speak. And I know you're called Sound Health Services, but it is the largest privately owned ENT group in the St. Louis metro area.
That's right, yeah. Otolaryngology is our official medical term. No one knows what that is, so ear, nose, and throat physicians, yeah. And there's 25 physician practices, practitioners in town. We have another 17 audiologists. We cover about 15 locations around the metropolitan area, but we're a private practice group.
So usually what people do is they might go to some storefront thing, and the people who they're dealing with aren't, and it's no crack on them, but I'm saying that they're not dealing with true pros in the field, correct? And this is giving access of true professional ENT help to somebody at a really beautifully convenient, accessible level.
That's right. Yeah, what you're referring to is the opening of a new walk-in clinic that we have called the ENT Now, and the idea behind that is that we practice in our group just like any other physician practice does. We wait for primary care physicians to refer patients into us or patients to find us and come see us as a specialty. But we feel like that there's a broader reach of that there's a lot of people that could benefit from specialty care in more of a walk-in environment. There's a lot of moms and dads that have kids that can't get in to see a specialist or a pediatrician and find themselves at other urgent care locations or, God forbid, having to go to the ER for things that could be taken care of in a more cost-effective way directly with a specialist.
Well, especially now as we're getting into full-blown allergy season, there are going to be a lot of things that pop up and people need somebody, and instead of going to the ER or whatever, they can go talk to you guys.
That's right. Yeah, this St. Louis is a great place to be an otolaryngologist. There's never a season that we're not busy. So yeah. Winter season, there's a lot of ear infections and sinus issues, and certainly we're hitting that big peak of allergy season right now as well.
Yeah, the doctors have said that over 50% of what goes to the walk-in clinics is actually ENT related.
Yeah. Well, but isn't it more expensive when you wind up doing it that way, though? Like if you pop into the ER, that becomes hugely expensive, correct?
Without a doubt, and just the multiple layers involved. So even just seeing a primary care physician being referred in, we appreciate that certainly. But being able to get directly to the specialist in that area, but certainly going through an ER, it's much more cost prohibitive to do that. If you can get access to a specialist in an easier fashion like this, it's going to be great.
Well, and also eventually what you're going to have is an ability, and you do now, an easy ability to go ahead and make appointments. Sometimes you can actually even, ultimately it's going to be a situation where you can even time your appointment so you can walk in and there's absolutely not even any waiting because you've already kind of queued up.
That's right. Yeah, the location and the facility is going to be great. It's going to have good exposure up and down the 270 corridor, and I think it's going to be easy for people to get in. Ideally, we envision this a situation where you can get yourself in line. Many ERs around the country are doing that as well, and it's pretty easy technology to do to be able to get a spot, get in there, get seen, get out, and on your way home, spend some time with your family.
You'll have an app for that and everything else, right? Mm-hmm. And it's going to be right there at 270 in Manchester, correct?
That's right. Yep. In I think it's called the Pear Square area there.
Right. Mm-hmm. Which is perfect because whether you're in St. Charles County or whether you're in Jefferson County, whatever, it's pretty pretty easy. It's a pretty central location there.
That's right. Yeah, we're looking forward to getting it open, and of course, all of our physicians still have their practices out there in the community. There are 15 other locations that we're always available to see people as well.
So we can get you guys at soundhealthservices.com, soundhealthservices.com, correct?
That's correct.
And they can come see you now.
Absolutely, yeah, absolutely. No, all of our docs have been in practice for years. The organization's been around as a single entity for about 13 years, but all the physicians have practiced for decades before that.
And balloon sinuplasty as well.
Mm-hmm.
Great.
That's right.
And just so you guys know, Dr. Hardeman's a big fan of the radio station. This is his radio station.
Thank
right
you so
here,
much,
everybody.
sir.
I have one radio station in my car.
Great.
Well, you're the best, and we appreciate you very much. SoundHealthServices.com. Thank you, Doctor. Thank you, Dave.
Thank you so much.
Thank you.